Hi, I'm Cari Ann. I'm a dental hygienist here at Reed Family Dentistry, and a lot of times I get the question, what is periodontal disease or what is gum disease? It's basically a bacterial infection. It affects everything that holds the teeth in, so it doesn't actually cause cavities. It destroys the bone tissue and the gum tissue, everything that holds your teeth in, so that's why people end up losing their teeth. There are ways to treat it. You cannot cure it, but we're great at treating periodontal disease and helping people keep their teeth for a really long time. There are certain procedures that we can do to basically disinfect, remove a lot of that bacteria that's underneath the gum tissue that your toothbrush and your floss, your rinse simply can't get to. We also talk about the different things that you could do at home, like maybe an electric toothbrush, maybe add floss, maybe add a rinse, that kind of thing. Then we typically like to see you every 3 or 4 months because that bacteria is going to grow again. So as we see you, we flush that gum tissue out again, try to get you to a healthier state, and that ends up making your whole body a little bit healthier. They do have relationships between, say, rheumatoid arthritis, heart disease, diabetes. We're seeing those links all the time. The medical field is actually finding out that there's more and more links between those. So if we can make your gums healthier, sometimes we can make your whole body healthier.